welcome to the Mental Health Action Partnership learning session on the Advancing Behavioral Health Initiative, learning from local mental health coalitions. I'm really delighted to see everybody here today. We're going to have a presentation by Dr. Michelle Broadus, who is the principal investigator for this 8-year initiative to foster local mental health and substance use coalition building around within 10 areas around Wisconsin. And then we're going to have a panel of folks from some of those coalitions who will talk to us about what they did and what they learned and what we're carrying forward. And then we're going to go into breakout rooms for about 20 minutes to chew on it. We'll talk about what you've learned that you might be able to apply in your local area and what we could do as MHAP working together at the statewide level. And then the session's going to end with a brief overview of the ABHI brand new hot off the press strategy guide. So they've learned a lot and they're posting it on a website, which is really terrific. But before I hand this over to Dr. Broadus, just a brief word about MHAP for those of you who are new. The Mental Health Action Partnership is a new-ish, like it started in October, a newish statewide long-term mental health coalition representing stakeholders across the continuum of care throughout the state, across the lifespan, and throughout diverse communities. And we're working together over the long term to advance ongoing behavioral health system improvement throughout Wisconsin. So if you're interested in joining in this work, you can drop an email in to Julia at NAMI Wisconsin. She is on this call right now and she'll drop her email in the chat and we would be happy to sign you up. Right now, the partnership is wide open and we're just inviting everybody in. So we would love to have you. But so now I'm going to go to the presentation. Dr. Michelle Broadus is an assistant professor from the Medical College of Wisconsin, the Department of Psychiatry and Behavioral Health Medicine. And I will just turn this over to Dr. Broadus and let her introduce the panelists.
Hello, welcome everyone. Thank you so much for joining us. I am super excited to bring you some of the wisdom that has been accrued by the ABHI learning community over the past 8 years. 8 years, hard to believe, but it's been an amazing opportunity for me. I am going to share some slides, and I will try to keep an eye on the chat. If there are questions, feel free to interrupt. We will have some time to talk in breakout sessions, as Sita said. And I am delighted to kind of seize on this opportunity to continue to move the work of the ABHI forward. Each of these communities has done amazing work, and the work continues. And I feel like MHAP is a great platform to disseminate some of our work and make more connections. So I'm going to go ahead and share my screen. Okay, everybody seeing that? Thank you. So yes, as Sita said, I am Michelle Broadus. I'm an associate professor in the Psychiatry and Behavioral Medicine Department, but I am not a psychiatrist. Let that be clear. I am a researcher. So today we're going to be talking about a few things. I'm going to provide a brief overview of the ABHI and how it was kind of unique. We're going to share some stories and discuss some lessons learned in the panel, and we'll be definitely open to Q&A with audience members. And then at the end, we'll talk about the strategy guide and how you might be able to use it in your own communities. And we hope that this learning session provides a bridge between the work that's been going on over the last 8 years by the ABHI and some of the new things that we hope to continue doing through the MHAP. So the Advancing Behavioral Health Initiative was funded by the Advancing a Healthier Wisconsin Endowment, which is associated with MCW. It was funded, the funding was provided to 10 different community coalitions all across the state and one academic partner team at the Medical College of Wisconsin, which I have been privileged to lead. There were 3 phases of this grant, and I think it really speaks to the forward thinking of AHW to kind of experiment and innovate with this new grant funding structure. It was 8 years divided up into 3 phases. The first year was learning and planning. Second year was actual implementation. And third year devoted to sustainable transformation. And as you can see, we are rapidly approaching the end of our time grant funding. We'll be presenting some of this work also at the HW 20-year anniversary conference event that will be June 20th up at Lambeau Field. So if you are interested in that, we can certainly provide you direction to register for that. It'll be a great event. Just wanted to put this up here to show the amazing geographical reach that this project had. We had urban, rural, and tribal communities that were all funded through this initiative. So to get a little bit more into what we did, in phase 1, we had an entire year of learning and planning. So these coalitions, as well as the academic partner team, were selected through a competitive process. But the coalitions did not apply to say that here's the thing we want to do, or here's the program we want to bring to our communities. They were funded based on the strength of the coalition they had brought together. You talked a lot about in phase 1 how we were sort of building the plane as we were flying it, which allowed us to really be creative, allowed us to play and explore, and it allowed us to do things like, thinking about each community's needs, what data they're going to need. Spent a lot of time doing coalition building. I think in that first year, one of our coordinators did over 100 one-on-one meetings to really bring people into the coalition in a thoughtful way. And we convened every month that first year in a learning community facilitated by an independent consultant, Paul Schmitz. Phase 2 was 5 years of implementation. So once the communities had spent that time in phase 1 learning and planning, phase 2 was about really digging into the community and implementing those strategies. And I should say that strategies were really focused on systems change rather than potentially individual change. It was about bringing people together. Coalition, the strength of coalitions is that people and organizations and sectors are brought together to share information, build relationships, and think about how can we break down silos? How can we improve practice and policy in order to support a better system overall to help folks with mental health challenges? And we did continue the learning community in phase 2. Phase 3 has been our final phase, 2 years of what we've been calling sustainable transformation. And HW allowed us these 2 years, I feel like, as a sort of runway because they understood beforehand, you put money into a community, they do great work, and then the money goes away. And this final phase allowed us to do some planning for sustainability, disseminating of what we've learned, for example, things that we're doing today, and really talk about how do we keep moving forward, how we keep this work on systems change moving forward. This is an incomplete list of some of the strategies that were implemented by the different communities. I'll get more into that after we come back from the panel discussion and breakout rooms. But there are a wide variety of school-based strategies, community-based strategies, and strategies dedicated to improving access to resources. So it's hard to put on one slide what the lessons learned were. I have learned so much over the last 8 years as a result of this project and that knowledge has been priceless. But some of the things that we think are important to share back to this group is the need to understand that coalition building takes time and you have to do it thoughtfully. You really have to be considering who's at the table. And having a variety and diversity of people at the table in multiple ways. Multiple perspectives are needed, including not just the people that have the power to make decisions. Those are important because they can really affect change. right? But also the folks that are implementing these strategies, quote unquote, on the ground, frontline sort of folks that are really embedded in their communities. We understood, over time, these coalitions changed, they evolved, people come and go, and that's fine. But ways that that the coalitions were able to maintain engagement was ensuring durable communication channels. And the importance of diversity of viewpoints doesn't end once you bring your coalition together. It's an ongoing process. And we've also thought about this idea of being on the dance floor versus being on the balcony. Some folks are very used to having their voices be heard, and we need to be very careful about some voices may get overlooked. So I've been really taking that lesson to heart and thinking about, when do I need to be speaking and when do I not need to be speaking? I'm very excited that we're going to actually hear from the folks doing this work, while I will be up in the balcony a little bit later. And you need to plan for sustainability early and often, which is a result of doing some capacity building of local leaders. We think that effective coalitions are ones that can change and adapt over time, ones that bring diversity and authentic engagement, and ones with solid yet flexible processes and structures to ensure that people know what their role is in the coalition, how people should communicate with each other, organizational structures. I want to share some words of wisdom that I've collected over the years through various conversations and focus groups. One of our ABHI members said it this way: work in a space where everyone is unhappy and no one owns the whole thing. Take time for exploration because there are no shortcuts. Bring your whole self. There are a lot of others doing this work. Don't isolate, don't silo. And if I had to give one sort of phrase that has become my catchphrase for this project, relationships are an outcome. I wanted to bring up a quick case study that I think might be of particular interest to the MHAP, which is the Milwaukee Coalition for Children's Mental Health. They did a lot of work in building their coalition thoughtfully. There are a lot of coalitions in Milwaukee, and they wanted to make sure that they were distinct and had a clear purpose, and also had that they brought values to not just the work that they do, but how they do the work. So they spent time doing an explicit delineation of those values. I won't go through them all, but you can notice they've highlighted the importance of empathy, respect, dignity, equity, inclusion, diverse experiences, and active participation. And they attracted what they've been calling context experts. Sort of in comparison and contrast to content experts. These are the folks that have on the ground leadership in many different sectors, but specifically for people with lived experience. Many members have moved on to other opportunities because of the work done by the Milwaukee Coalition in building those capacities and developing a pipeline of future leaders in Milwaukee. So now I am very pleased to introduce you to our panel of experts. We have 4 different coalitions represented on our panel. From the Schwamagon Accountable, the Community for Health in Ashland Bayfield counties, we have Wendy Kloiber and Amy Syverson. From the Marathon County School-Based Counseling Consortium, we have Aaron Ruff. From Mental Health Matters in the Chippewa Valley, we have Elizabeth Hagan, who I heard may be having some stuffy nose issues, so we'll give her a bit of grace as she still was able to join us today. Thanks, Elizabeth. And finally, from the also from the Milwaukee Coalition for Children's Mental Health, we have Leah Jepson and Aaron Malcolm. And I will escape it and stop share. Bring back my view. So I thought we could go around and have our panelists introduce ourselves before I jump into some questions that we have put together for the panel. Wendy and Amy from Schwamagan. And I finally figured out how to pronounce that correctly.
Thank you so much. I'm Wendy Kloiber. I am the director of the Resilience Alignment Beekeepers, which is the backbone organization for CATCH, Schwamagan Accountable to Community for Health. CATCH is a group of public health and safety facing organizations, primarily counties, law enforcement, school district, and local providers, as well as our rural critical access hospital. And the key development for CATCH is the CATCH plans, which is a community safety plan that can be made by a participant in advance. The crisis is stored in a HIPAA compliant database and can be retrieved by members of the coalition for the ROI that we have for participants.
And I'm Amy Severson. I also work with the Resilience Alignment Beekeepers and CATCH, which Wendy described so well. I work with project implementation, and I just want to give a little shout out because here at this meeting, we have two of our partners who've been there with us since the very beginning, Val Lovno from Ashland County and Tom Jensen from Tamarack Health. And without them, this project would not have gotten to where it is.
Thank you. Aaron Ruff.
Hello all, good afternoon. I'm Aaron Ruff. I'm a public health educator here at the Marathon County Health Department. And I had the privilege of being staffed to the Marathon County School-Based Counseling Consortium, which did not exist 8 years ago. And so we had the gift of an 8-year grant that got our coalition off the ground, focused pretty much solely on school-based mental health counseling. And we have seen an incredible amount of passion and success with expanding school-based mental health here in Marathon County. So I'm excited to share more with you about our experience. I just want to emphasize a few things that Michelle said, is that we had this incredible gift through the Advancing Behavioral Health Initiative of learning alongside 10 other communities in Wisconsin. And we had that gift of time. We had 8 years to do this, and I can't believe it's over. But when I think about how the lessons we learn can apply to MHAP, it's that we have spent, half of my life basically in this work. And so it's just the gift of time and how essential that is to advancing strategy. So happy to join you all today.
Thanks, Aaron. Elizabeth Hagan.
Hello, everybody. So sorry if I sound awful, but my name is Elizabeth Hagan. I'm with the Mental Health Matters Coalition, and that covers both Chippewa and Eau Claire counties. And our focus was really on youth mental health, looking at ACEs and how to build resiliency, doing some mindfulness in the schools, and then looking at some data. And I was the project evaluator for the grant through the second part of the grant because I wasn't here right at the beginning. But yeah, that's me.
Thanks, Elizabeth. Leah Jepson and Aaron Malcolm from Milwaukee.
Hello, everybody. It's great to be back. I am Leah Jepson. I am the project director for the Milwaukee Coalition for Children's Mental Health. I came on 1 month into the first phase of the grant, so I've been here. I don't even want to see a picture of what I looked like that month, because I think 8 years is a long time. It's just like, what? So yeah, I'm really grateful to be here. I am also the executive co-director of the Next Step Clinic, which is a free autism evaluation clinic that kind of sprung out of this work it would not have happened, I think, without this grant. And I am also employed by Mental Health America of Wisconsin. And I am really, really glad to be here. Aaron, you want to take it?
Sure. Hi, everybody. Great to be here today. I'm Aaron Malcolm. I was the lead evaluator for the Milwaukee Coalition for Children's Mental Health. And I think, as Michelle said, we came into this work not having a solid plan, really sort of developing that as we went along and taking new opportunities as they came along. So just the whole evaluation approach for this project has been so very different than a lot of other sort of evaluations that I've worked on. And it's been awesome, but it really does mean that you're sort of doing it as you go along and doing more of a developmental approach to evaluation and telling those stories. So I encourage you guys, I don't know if our panel is going to talk much about evaluation, but I would really encourage you guys to think broadly about how you're approaching your evaluation plan for this project.
Very good point, Erin. And I should note, Elizabeth's also one of the evaluators. I should note another unique aspect of the funding structure was that AHW actually required each coalition to apply with a full-time coordinator and 50% for a local evaluator, which, to be honest, as the academic, made my life so much easier. And I agree with Erin. We had to be a little bit more creative about evaluation and realizing that the qualitative data is just as important as those numbers. Being data driven doesn't just mean stats and charts and pie graphs. It's about stories too. So speaking of stories, that's why we're here today. I want to let our panel tell some stories. To start with, I think what might be interesting to this coalition as it's sort of newer and developing. Speak about how your coalition came together. For some, it might have been specifically for this grant, or for others, it might have already existed. So reflecting back on the 8 years ago, how did your coalition come together and how did you develop a sense of purpose?
Well, I'll start because I don't have too much to say because I wasn't there at the beginning. But I do know that this group, the Mental Health Matters Coalition, did come together because of this grant. Like that was what made the group come together. And when we first came together, we didn't actually know what we were going to be doing. We know we kind of wanted to focus on youth and younger people. Initially, they were thinking we would do like early childhood stuff, but we had no data for that. We had nothing to go on. So we ended up doing middle school and high school and looking at, the YRBS data, the Youth Risk Behavior Survey. But that's what I know.
I'll jump in next. We sort of had this perfect storm brewing 8 years ago where we had a local rural school district that had recently partnered with a mental health clinic to begin offering services. And I think we got the grant like within months of that happening. And so the buzz had already been created. And it was very early on in our project that we sort of identified the passion and engagement for increasing school-based mental health services. And so that's how it all formed. It was honestly like the perfect alignment of events. But what did it require? It required monthly meetings, so much conversation and communication. I can't stress the importance of having backbone staff enough. So the fact that we have the fact that MHAP has support from NAMI sort of serving that backbone staff role is huge. That's going to be incredibly critical for any forward momentum for this group or any group, is to have backbone staff to do all of that communication in between, writing, doing all the things that are behind the scenes. That's just so critically important. And so myself and a colleague of mine were able to fill that role early on. And I mean, we could spend pretty much our full-time job funded through this grant to do that work. And it was just so critical to get all those partners at the table. So the momentum was there. And then we had the staff time and resources to be able to sort of foster and nurture those connections. That was super, super critical.
Talked about what it takes. Would you like to share a little bit more about what did it take to define your mission and vision or goals and values?
I'll go quick. I mean, it was again a lot. It was a lot of monthly meetings, conversations. I mean, and this didn't take shape in, 3 to 6 months. This was probably a year to 18 months worth of work before we really had our Marathon County School-Based Counseling Consortium formed. And so again, I sort of offer that as advice and to MHAP is like, this is going to take some time. We're not going to have all the answers in these first few months. It's about building trust. And I think a lot of what we did that first, 12 months to 18 months was building trust, learning the partners. For us, Marathon County is really split between urban and rural, and just getting urban and rural school districts in the same room was just a huge accomplishment for us. Just being able to have them, bounce their ideas and things off each other. So, the gift of time was great. Knowing we had 8 years to accomplish it, I think it was helpful. It's sort of, I remember having the pressure taking off us a little bit, like this will take some time to build, but it's just that, building trust, like Michelle said, and lots of conversation.
Wendy and Amy, anything you want to add about sort of that beginning phase? You're coming together, you're doing the work to get people in the same room and figuring out what different people's goals are.
Absolutely, and I would invite Val and Tom to step in to it, because they have probably more valid memories of this than we do. There are kind of a couple strands in our origin story. One is that we knew we wanted to work in mental health crisis response because specifically it was an area where no one owned the entire thing, and everyone was to a certain extent unhappy with how it worked and had a sense that it could work better. So we felt that it would be a good topic where there would be the possibility that we could map it out and kind of figure out how we could make change in that system. And as we were pulling together that first meeting in the month right before that, we had a really tragic incident here. A Native American youth was killed in law enforcement response to a mental health call. And for a while it felt really up in the air whether we were going to be able to pull this group together at all, whether there was enough trust. Unfortunately, there was an elder from the Bad River tribe who didn't come to the meeting, but gave it her blessing. We moved forward from there, and we're incredibly fortunate in that we've made a relationship with Karen Timberlake, who drove up from Madison. She was not at DHS at that point. She was still at Michael Best, once a month, and we would have 4-hour meetings. And those meetings would have pre-work, and then we would work in the meeting, and then there would be post-work. So the investment, the level of time and commitment and energy that our partners had to put in was enormous. And what it got us was a couple of things. A sense that the place where we could really make a difference was in that moment of crisis where you have a person in need facing a person who's maybe never met them before and who may or may not be particularly skilled in working with crisis. And that usually that person that was in that crisis was in a relationship already with someone who was in that group. Someone knew that person, and someone had a sense of what might be helpful. And from there, we started to think, how could we infuse that information, that sort of information from the person themselves, the information from their community of support into that moment. And we started building out plans, but it took us a long time mapping out the system and talking about where we thought those opportunities for improvement in the system were. And then it took us another long time once we had that, we want to create this plan to sort of build that out and do it in a way that was legal and ethical and also had in it useful information. And 8 years later, it's not perfected by any stretch of the imagination. But there's a strong feeling within the community, within that group of people, that it's useful and worth continuing. And And a thing early on that AHW did was to ask us all to identify indicators, needles, that if they were moving in one direction or another would let us know if our project was successful. Ours was emergency detentions. And I'm really happy to be able to tell you that our emergency detentions have dropped significantly. Now, do we have a sense, like absolutely with certainty, that it's our project that did that? No, we need like way more research. Like we thought we had enough research to be able to make that connection. And like Michelle is still working on pieces of that for us. But it was that, can we take this thing that is so hard on everyone, both the people who are going through it, the people who are in position staffing various pieces of that process, and make it better for everyone, was really, I think, a crucial piece of mission. And that the hope that something that could come out of that, and also the 8-year funding. Like, I remember like an early meeting where it was like, one of the conditions for success was, you guys need to stay. You can't go anywhere. Like, we're not going anywhere. Like, we're here. We're going to work on this for as long as we can. Yeah. Amy, do you have anything you want to add that I missed?
I think you got it.
I remember one story I'll share. I remember, so we went through the first year of funding, and we were not guaranteed to get the second phase of funding. We sort of had to reapply. We were all practicing our pitch speeches to the AHW consortium because we'd been together for an entire year, and the idea that any of the coalitions would not have gotten funded in phase 2 was abhorrent to us, which we told AHW, but I think they had their reasons for that. But I remember we were practicing our pitches when Dean sort of asked people to take a step back, close their eyes, and imagine you're an individual who's having a mental health crisis. And imagine if the outcome of that crisis is that you are handcuffed, you are put in the back of a squad car, you are driven away, hours away from your existing support system. So when we think about, as Erin brought up, evaluation, when you evaluate a program like this, it's also important for us to remember that one person that could have been touched by this project. Leah, Erin, anything you want to talk about as we're thinking about sort of that beginning stages as you're coming together and you're organizing yourself? So how did you really decide how you were going to structure the coalition?
Yeah, I think for us, we were starting, our coalition was developed for the purpose of applying for those phase 2 5-year funding. And so I came on after the first application was awarded. And Erin and I just Erin came on like a month later, I think. And so we really looked at the lack of engagement with parents and caregivers in our community. So I'm in the city of Milwaukee, and we're looking at children age 0 to 8. And so you really need to be able to engage their families, their parents, to get it in order to get kind of innovative information about how we might address these entrenched disparities in children's mental health outcomes. And we also knew through both of our work histories, working with other coalitions, that it's not been done super well in our community in the past. And so when engaging, we really want the disparities that we were finding disproportionately affected children of color and children who were living in poverty. And so we really needed to build that trust and build that accountability on our end, that we would be there and we would create those opportunities or create that space, if you will, to bring in a really diverse group of people. And so while I did not do 100 one-on-one meetings, and we couldn't directly engage parents until the second, until that second year. I established a whole bunch of new relationships, I think over 80 one-on-one meetings with faith leaders, with other initiative leaders, with community health workers and other parent peer specialists, other trusted connectors. And so that was really important for us, so that early on, we were building this into the way that we come together, as opposed to trying to do it down the line, which really puts the brakes on things. Erin, would you add anything to that?
Yeah, I'm really glad that you mentioned the part about other coalitions and other initiatives locally in our community, having not really done a very good job engaging those most affected by these issues. That was something we knew that a lot of mistrust had been built up, particularly among folks who had, been brought in on a previous initiative to do a listening session, and then all this information gets compiled and the initiative just sort of goes ahead and does what it wants to do anyway. So I think that recognizing the mistakes of the past and trying to avoid those was something that was a lot like part of one of the biggest parts of the pre-work that we had done. And to Leah's point, just having to go back and in many ways sort of repair some of those relationships, or do extra convincing to folks that might have said, well, okay, well, I was involved in this other thing, and it turned out to be a total disaster. So I would encourage you all to keep that in mind as you move forward, learning from those lessons from the past.
Yeah.
Can I just add to that real quick? Just so that we're not just throwing other coalitions in Milwaukee under the bus. I led one of those coalitions and we did a terrible job of engaging parents. We just needed one at the table. And back then I had no idea how to do that. And so seeing what we've accomplished now versus my experiences as a new coalition leader 12, 15 years ago, really, it's worlds apart. So I'm owning up to some of this too.
None of us are perfect. We all make mistakes. Nobody gets it right the first time. So, I do think that that's important to realize. We will screw up, as long as there's an accountability to that. And I feel like what the coalitions have done so well is build in an accountability, not really to the funder per se, but to each other. So I'm wondering if you could talk about, as a new developing coalition, this MHAP, we want, and we have a great diversity of folks from all different sort of professional roles, personal lived experiences. So how do you ensure that, one or two people don't just, take up all the space, all the air in a room? How do you really ensure that there's a fairness and equity to whose voices are heard?
I will just jump in since we're kind of on the same track here. Facilitation is really, really important. And also having kind of backup and this applies to in-person meetings and virtual meetings. If you're presenting, you really want to have other people who are paying attention to what's going on, paying attention to the chat in the case of a Zoom meeting, but also really paying attention to body language, what's happening in small groups, like at the tables, and just seeing if people look like they're checked out. And then also like really being, so for us, we ended up developing shared agreements. A one pager about these shared agreements that we collaboratively developed and how we were going to show up in these spaces. And we would go over them just briefly in the beginning of every meeting, just so that should there be an issue where someone might be kind of taking up too much space, or just really taking control of things, that then we had something to kind of fall back on. And that really helped us. And then also to early on, we had some folks who would text one of us. So if they didn't want to like leave the room or something, we would get text messages like, hey, I just noticed so and so is struggling, just like if we were sitting at tables, not when I'm in the front of the room. But I think those are just little things that you can do to be really cognizant of, how you meet and how you show up.
Mm-hmm.
Yeah, I'll just echo what I said earlier, and just building on the relationships are an outcome piece. I mean, it's all about trust and getting to know people. Like, why are they at the table? What's their stake in the game? I think it's spending time engaging with people to get to know them. And I think, it's something we can do in MHAP too, is just learn more about each other, why we're here, what we're passionate about. That will help us build cohesion, and then, figure out what is it that we want to accomplish together. So, it's definitely a time factor. We got to get to know each other. We're just, we're just getting started here. It's only March. MHAP is still new and fresh. Like, we're in a good spot. We're just starting the journey now, and we have to remember that. So
Go ahead, Elizabeth.
I was going to say one thing I would add too. So I came into the grant kind of partly through that stage 2, where we were actually implementing things. All of kind of that pre-work had been decided. The coalition was established. But something that really helped me, especially considering I was some of that grant staff, was Brenda, who was the coordinator, would each year she would have one-on-ones with some of those with the steering committee members, so the members of the coalition that were really getting things moving, and those movers and shakers and decision makers. And when I came on, she was planning to have those one-on-ones again and invited me to all of those. And so I got to meet every single one of those steering committee members and build that relationship right from day one when I started. And it was really good because as a new person, I got to hear about the coalition like 15 times. And so by the end of that, I knew it. Like I knew what the initiatives were, I knew what we were doing, like all of those kinds of things. And so I would say I can't stress enough the importance of one-on-ones, whether that's getting to know new members or having new members get to know older members or whatever it is. It's just such a great time for relationship building, and also just learning about what's happening in the coalition and all of that kind of stuff too.
Yeah. You bring up a really good point.
Can I add one thing to that, Michelle? I mean, I think one of the things that our coalition was very diverse in that it had, higher level decision makers and, parents and representatives of the community. And I think one thing that Leah was very deliberate in doing in her facilitation was leveling that playing field and reminding, folks who might be academics or people who are used to being the ones that are making the decisions, that their voice was just as valuable as somebody who's representing, parents and caregivers, and that nobody really, just by virtue of letters after your name, that doesn't mean that you have more important things to say.
Yeah, for sure.
And I'm going to piggyback on that too. We two other things that we did is when we did have conflict, we brought people together in smaller groups to address the issues, and which is where our shared agreements came from. And we also through that kind of sidebar meeting, which happened a few weeks later, we decided through our coach Paul Schmitz that we were going to build unapologetic community building into each one of our meetings, which basically is creating, like, intentionally and unapologetically creating that even playing field. So like at one point we had a woman who taught urban line dancing, and I have zero rhythm, right? And so I made a complete fool out of myself in front of 45 people, while other people were just like thrown down and just like rocking it out, right? So like to do that so that you're lifting up some folks and you know, and just kind of like evening it up. So I just wanted to, oh, and we stipended parents and lived experience partners who weren't, when they came to the meetings, who weren't already being paid by an employer.
Great points. And you know, I think when you do coalition work, usually people are not coming to the coalition because it's their job. They're coming to the coalition because of their job, maybe, or because of their role. These are busy folks, right? They're choosing to contribute to an effort. So how do you make it worth their while? How do you make a meeting that people actually leave and think, you know, I'm glad I went to that meeting? And how do you ensure good communication so that you're not just flooding people's inboxes with lots of emails, but you're, you know, being a little bit strategic about it?
I can talk a little bit. The Brenda was very, very good at this, but she always made the meetings as action-based as she could. So there was always a purpose for meeting. We didn't just meet to share information, but there was always a reason, something that needed to be accomplished, something, you know, that we needed shared or feedback or, you know, whatever it may be. So trying to keep those meetings kind of as action oriented as possible and really involving the group. You know, Brenda and I, if there was something, we would get something started, but the group is the one that really did the work. It wasn't always just, you know, Brenda and I saying, here, we put this together, approve. You know, it was really them making everything. We did a we created an ACE resiliency training, a 2-hour workshop. And Brenda didn't create that, right? Like the work group created that. And I think that's really powerful, and it creates ownership and sustainability in the project. Yeah, Brenda, thank you, Michelle. Brenda was the coordinator again for the Mental Health Matters Coalition. She couldn't be here today. She's visiting her daughter in Colorado.
So I could sit and listen to your stories all day, but we do want the opportunity to break up into some smaller groups and kind of digest some of this. But before we do that, anything that the panel wants to share about again, the early days of the coalition, or the work that really is in service of orienting the coalition, structuring the coalition, ensuring good communication. And even if you want to talk about how coalitions naturally evolve over time.
I'm going to speak to I guess it was maybe 2018 when that we were introduced to a white paper called The Waters of Systems Change, which was a total game changer for us, honestly. And really, I think was a helpful way for us to communicate with our coalition that we weren't doing programs and interventions, that we were focusing on systems change work. And having a tool like that was so helpful to communicate what we actually meant by that. Because I think it's kind of hard for a lot of us in the nonprofit world and the human service world we just sort of think in programs and services and interventions, and to sort of shift the whole mindset of the group into really thinking about, you know, changing mental models and going after like big and little p policy change was really helpful and important. Thank you, Michelle, for posting that in the chat.
Yeah, and I think it does underline that the grant was aimed at systems level change. And you know, as a psychologist, I was trained as a psychologist. I historically have measured individual behavior. So sometimes it's hard for a lot of folks to get their arms around what do we mean by systems change, especially because systems are so complicated. There's a lot of moving parts. There's a lot of moving players, each with their own sort of agendas, not necessarily in a bad way, but so, pointing out tools, such as this white paper that can help people organize and orient themselves. Any last words from the panel before we go into groups?
Along that line too, I would say that we, because we were formed specifically for the purpose of applying for the grant, the first two phases, we also had to, I think it was like, yeah, it was like 2019. So it was about 2 years in to the 5-year phase 2 that we brought in a facilitator and some of our leaders and some of our members to really figure out what it is about our meetings that resonated with people and that kept people coming, because we are no longer developing strategies and bringing, we already had our work groups. That was where all this stuff was going on that we said we were going to do, but we still had these coalition meetings. And so we were able to drill down to why we're doing this, why we're still convening, and not just because we're supposed to, right? And so we learned through that a lot of it was really about coming together and sharing resources and building relationships. And this was while it was still in person, right? That changes. But it was a really it was a significant transition for us, and it really helped clarify what our purpose was once we got through those initial couple of years of the grant.
I just want to
Right, go
make
ahead.
one quick point and emphasize what Michelle said very early on is, it does early on, it does feel like you're building the plane as you're flying it. And that's an okay space to be in. That's one of my biggest takeaways, I think, from the whole project is like, it's okay to be in that space. That's where the magic happens. That's where like, we're all in the room trying to figure it all together. So I think that's pretty much where MHAP is at. It's like, we're here, we understand the purpose. We're just trying to like figure it all out. We don't have all the answers, and that's okay, but like it will come, and it's okay to be like uncomfortable with that. And as long as we're here for the right purpose, et cetera, we're engaged, it'll happen. So
Yeah, you've got to be innovative and flexible.
Yeah. And Amy, see you and
Yes.
I jump in.
So I wanted to just put a little shout out to Michelle. So during phase 2 of our project, she worked with our first evaluator, Sean Ackerman, to put together a paper based on interviews with our partners called Pathways to a Coalition. And out of that kind of came our top 5 kind of things that helped our coalition cement itself. And those were, we found and developed a shared mission. We had an iterative process that gave it focus. And I think that was really the key, because people got to come to the table. We would say, hey, here's the idea. Here's what you told us. Here's what we could do with this. Give us some reactions to that. And then we would do that process over and over again. So the meetings kept generating and being reflective on the process. And then having a person-centered ethic, having people with lived experience at the table, having enough time. Those 4-hour meetings were really critical to building those relationships. You don't always have to do 4 hours, but they were really helpful. And then noticing the absence and the inclusion. Sometimes it's not possible to get everybody to the table, and maybe that's because they don't have time to be there, but noticing them, making sure that you're keeping that in mind as you move forward. So those 5 pieces are kind of outlined in that paper. So, nag Michelle if you want to look at that deeper.
No, I'm the worst academic ever because I haven't published anything on this yet, but I am happy to share the draft of that. I'll turn it over to Sita to sort of transition us into breakout rooms where we hope we can have some smaller discussions about what resonated with you about this discussion, and how we might apply the ABHI to the MHAP.
Yeah, thanks so much, Michelle, and everybody. That was just fascinating. And, I'm just reminded that if you don't want to, that lessons learned, it's really important to share lessons learned. So we're going to go into breakout rooms until about 3:35. And so people are kind of coming and going. So I think you're going to have like probably 3 people in your breakout room. So just, we've got some questions here. What did you learn that you want to apply to the goals or structure of MHAP or a local coalition that you're working with? The people in this room know a lot about the barriers to mental health and behavioral health. How do we scale up that knowledge? And then how do we harness the sum of our local knowledge and elevate it to educate state advocates who are working to change policy at the state level? So I'm going to send you into breakout rooms right now, and we'll just see how it goes. And we'll stay here until about 3:35, so that's about 8 minutes. So just share amongst yourselves whatever you feel led to share.
Hello.
Okay, everybody, let's just take a few minutes to reflect as a whole group. What came out of your learning sessions? So Amy and Alyssa and Michelle, I think you were in the first one.
Yes, we discussed in the context of the clubhouse model some of the advantages that it leads to that we could keep in mind in our going forward. Specifically, the way that it allows all voices to be heard, including those who are not used to being heard, and how it provides basically the clubhouse model is a vocational rehabilitation program where running the vocational rehabilitation program is the work of the tasks that are used to rehabilitate people.
Yeah, that's great. And the clubhouses are forming a coalition or have formed a coalition now, so that's great. Yeah. Group number 2, Erin and Betty and Claire, what came out of your group?
Well, I'll comment on what we just ended with, was that in coalition or community work like this, in our local groups or with MHAP, is people will change, people will come and go. There's always going to be that constant ebb and flow of like energy, passion, engagement. So we sort of have to like recognize that and build for it. That's a totally normal part of any type of collaborative work, is that the people at the table will change, but that's okay. But just to sort of recognize that's I mean, I can think of many examples where we lost a really good connection with the school district or mental health clinic, and you have to sort of forge ahead and figure out how do we either fill that gap or carry on.
Yeah, absolutely. And shared leadership is essential there, so that if one person steps out, the whole thing keeps on going. That's really excellent. Yeah.
We talked a little bit too.
Go
I'm
ahead,
gonna just throw in one more thing if I can. We talked about ownership too. I think a few others of my colleagues mentioned it earlier, but it's like, turning decisions over to the group, letting people create that sense of ownership. That takes time too, but the more we can collaborate and be together, creating that ownership of what we want to accomplish is important.
Yeah, and it's an uncomfortable place for people who are used to being in leadership to be in, is the actual sharing of power and information. Yeah. That's great. Thank you. And then group 3 with Hugh and Julia, Leah, and Stacy. What came out of your group? Stacy, go ahead.
This is Stacy. I facilitate a lot of meetings, so I just loved the panel's practical sharing solutions or whatever. So definitely like and will implement the idea of that safe text or safe message person in meetings. We cover a lot of heavy things in some of our stuff. So just to have that, I mean, we do a good job. We always have a facilitator and somebody kind of monitoring what's happening. But I just think there's been so many meetings where things get a little hot, a little warm, and just to know that somebody's struggling or, have a plan for somebody to step out if need be, but they could do it in a way without calling attention to it. I loved that. And then Leah just shared about the acronym NOC. I worked 20 years for DPI, and now I'm at DHS, and they're always the wrong acronym because I'm in a totally different state space. But you know, there's so many, and when you're so close to the information, you forget. You know what I mean? To always spell them out or share them the first time through or whatever. So I absolutely love that idea of being like, hey, wait a minute, like there are people here that don't know what that CRS or CSP or is just CCS. There are too many C's this week for the meetings I've been in, but I just love those little friendly agreements that can just make it so much better for everyone involved.
Yeah, that's great. And just mention who you're working with in your work, Stacy.
Well, I happen to be working with Sita and Julia a great deal in NAMI, but we have been within the deaf and hard of hearing community. We have very few providers that can provide services via American Sign Language. You know, so part of my work is to work with hearing clinicians and help them understand better how to work with that population. We've been doing some NAMI Smarts advocacy training with our group. We've had kind of an ongoing relationship going. So that's how I come to be in this space, because it just aligns. And the more we know about other things in the state, the more connections I can make within my work.
Thanks, Stacy. And then Jean and Rick and Wendy, what came out of your group?
So for what we talked about was, again, using that facilitator. So you've got an objective person in there and there's no balance of power issues, that this is my space, my meeting, I'm going to lead the charge on it. But we also talked about just taking the time to get to know each other and using on a personal level, as well as what we do professionally, to where we are really getting to know each other, build a bond, and forming a real relationship rather than a superficial, one-dimensional type of relationship. And we talked about how what the collaborations look like, the on the dance floor versus being on the balcony. It's such a matter of respect and communication, and understanding that communication is give and take. You listen and you talk. So
yeah, that's wonderful. Thank you, Jean. I love the relationships are an outcome. I mean, that's so important. And then group 5 was Aaron, Mary Kay, Robert, and Val. What came out of your group?
No one wants to volunteer.
Yeah, go ahead, Aaron.
Yeah, I mean, I think we talked a little bit about just how, I think in the the behavioral health initiative, we had the luxury of time and that flexibility. And I think, as much as this group can think about being flexible and what that means, and how important it was for us to pay attention to context and unexpected opportunities. I think that Mary was sort of asking how do you guys sort of translate some of this stuff into taking your work to a bigger scale, a statewide scale, versus sort of our hyper local approaches. And I think that is a struggle. I mean, I do think that, particularly going back and looking at the previous work that had been done at one of your previous learning sessions, and building off of what is already known about where the challenges and opportunities are in our state, is gonna, I think that's something that will serve you well, as being sort of building on the past and being open to new opportunities.
Yeah, thank you, Aaron.
The other thing that,
oh, go ahead. Yes,
sorry.
Go ahead, Val. Yeah.
The other thing that Mary said that I thought was real interesting is focusing on policy versus projects, something to think about.
Yeah, and we're in this for the long haul as MHAP, you know, so you had the luxury of 8 years, we have the luxury of decades, we hope. We'll see. That's great. And then group 6, Carlos and Elizabeth, Joyce and Thomas.
Well, I guess I'll talk because I pretty much kidnapped that group. um, so, so we were talking about the need to have like a pointing arrow of what is the main goal of MHAP, a mission statement, something that we can present not only to, I mean, well, I was saying, you know, we at NAMI, we know where NAMI stands when it comes down to these issues, but there are other groups and they might have the same goals, but they might have a different approach to it. So having a clear idea of where are we all pointing to, that will not only help us all kind of follow the same path, but also would, you know, when other groups, other organizations join the coalition, they will have a clear idea of what is it that we're trying to accomplish with this coalition. I was mentioning that we had a meeting a few weeks back where we were talking about, you know, whether if we made an ask, whether all the organizations would sign up or they will have to decide whether or not they do. So I think that I was telling Thomas, we need those 4-hour meetings to sort of figure out just what is the path that we want to follow and how we want to follow. Kind of get into the details of that of where we want to go.
That's great. You're making Mary Kay's heart sing because she is facilitating the governance work group, how MHAP governs itself. So anybody who's interested in those sorts of things, drop a line to Mary Kay and you can join the governance work group. That's what we're hammering out right now. And in between now and the May 22nd summit, which we'll mention at the end of the meeting, but I would like to turn this over to Michelle again to talk about the strategy guide, the brand new strategy guide.
Yes. So I have some slides, but I think I probably won't share all of them. I'm going to put the link to the strategy guide in the chat now. Oh, that's not it. Wrong one. Hold on. There we go. Oh, .com. Is that the problem? Nope. If you put that in your Google search, it should work. mcw.edu/strategy guide. And we'll send it out with the slides at the post meeting. I just wanted to point out a little bit of the elephant in the room. We had, 2 screens worth of folks that joined us at the beginning. And then when we said, let's go into breakout rooms, we lost a few people. And I think, that's okay. Everyone's busy people, and I thank you for sticking it out with us to the end on Friday afternoon. But I think it speaks to as the MHAP is coalescing and coming together and figuring out how we talk about things, being upfront about we don't want this to just be another meeting. We want you to come, we want you to participate. And so I just wanted to say thank you all for bringing your full selves. You've already sort of enacted one of our sort of words of wisdom in terms of bringing your full selves. So I just wanted to point it out. Thank you, everyone. I will share just a couple of slides to just orient you to the strategy guide. So we created this specifically because we wanted to disseminate all the knowledge that was built over the last 8 years in a diversity of communities, and we wanted it to be practicable and we wanted it to be actionable. We hope that it is a platform to continue discussions about mental health so that we can reduce stigma and build capacity. And there's a lot of information there that I really encourage you when you have time to go in and see what appeals to you. We have information on each and every strategy. so you can sort of see it's organized by strategy, so you can see where the community is, kind of what they did, what the impact they had, who was on their coalition. And then we have the list of strategies. Each of these strategies has its own page and has a lot of information. So if you see something in there that you think that could work in my community, this is a stepping stone for you to think about how can we replicate what was done in a different community and tailor it, make it your own, bring it to your local community context and make it appropriate. But there's tons of information about, who is it for? Who is it for? Who is the strategy for? What's the evidence behind it? Best practices, and again, that practical information about challenges that the coalitions encountered and how they addressed them. And I just want to point out one of our coalitions that wasn't able to be here today is the Lac du Flambeau Tribal Reservation. And they have a couple of videos that I really encourage you to take some time when you have a few minutes to absorb these videos. There's just a wealth of knowledge. There's some elder stories that are shared on this page that are very impactful. And there is some information also about the learning community that we created. Paul Schmitz gave us some great information to include on this page that broke down how he got us to be a learning community. I'd be remiss if I didn't put up this slide, which is all of the sort of current members of our learning community, but I will mention this is not comprehensive. There are quite a few people that have transitioned into other roles, but it also represents hundreds of individuals and local organizations that did this work, because the folks that are here are representing their coalitions, and their coalitions are made up of very passionate, smart, and dedicated individual members. So check out the strategy guide. And with that, I think I'm going to leave it with our last few minutes to hear back from the actual voices of wisdom in the room instead of me. I look to Wendy, I look to Amy, I look to Leah, I look to Erin, I look to, other Erin, that's why I got confused, and Elizabeth, as the experts. What would you like to leave us thinking about as we go into the beautiful weekend?
I'll just put another plug in for the strategy guide. Yeah, I know you're probably all ready to take off for the weekend, but bookmark it and check it out early next week. There's really a huge wealth of knowledge there from all of our local coalitions on strategies related to mental health. So I'm certain there's something in there that will catch your attention or relate to the work that you're doing in your own community. But the strategy guide is really sort of our culmination of the last 8 years, and it's what we're leaving as far as like, here's what worked, here are the strategies that we worked on in Wisconsin. So hopefully it becomes sort of that wealth of knowledge and a place, sort of a jumping off point. So thanks.
And I would just add to that as well, Erin, that there's especially those lessons learned sections of, maybe there's something in there that you're struggling with. And just look through some of those lessons learned and see, maybe there's something in there that, you can apply to your own coalition or whatever is happening right away without actually implementing a full strategy, but there's something in there.
Just one more thing that I'll add that Karen Timberlake did with us that I think might be useful here was to never go into a meeting without one or more straw models to react to, like to never ask a group to start from ground zero with something, but to always be giving something to react to, or maybe multiple things to react to, like maybe there are multiple choices, multiple paths forward that you could take with governance, to always be giving people, here's a way it could look. Here's another way it could look. What do you like about them? What does not work for you at all? So that it's not ever kind of having to start from to start from nothing, that you're always starting from things that have already happened that are already been enacted that are relevant to you.
I'm sure Mary Kay on the governance committee can attest to the importance of that already, right?
I would jump in about the governance piece. What we learned was that it takes a lot of time, and we really we were looking at other coalitions who had been in place for years, and we were like, oh my gosh, this is so just like loosey goosey, and yeah, and we realized it was important to take that time and to also really be vulnerable. If you're expecting people to come in vulnerable, to also be vulnerable yourselves and to share, and be authentic. And that's from a place of engaging people with lived experience, and also to really just create a safer space. I have like 100 other things to add, but I'm just gonna cut it off there.
I
You guys
just
know how
want
I
to
roll.
say the thing that we learned is we did come from ground zero with the governance part, and what we immediately pivoted to was we're going to take little tiny slices of this and we're going to define it, and then we're not only going to define it in little slices, but the slice is a picture today, and it doesn't mean what we're going to look like a year from now, right? So we're going to govern based on what our goals are for a shorter term period. And then our goal, of course, as Sita has said several times, is we want to be a long-term, coalition that's around for a really long time. And we don't want to be exclusive or anything else. So our approach has changed on how we're doing this. And just as you were saying, Leah, when I started diving into the research and the examples and the examples of governance, it got hilarious because I couldn't find very good examples of governance of coalitions, and I learned very quickly that's a fake thing. There's lots of toolkits on how to make a governance, but nobody gives you the example of what that governance is. So we're kind of doing it where we think we would be best served to keep everyone involved in this coalition as we build it across the state, because our goal is to be a long-term partnership across the state.
I think just acknowledging that everything is iterative is so important. That like this is where we're at right now, but it doesn't mean that we're going to be here. We can always add to it or completely change it depending on the group, right? And so yeah. And thanks, Wendy, for that. I really love that. Your wisdom.
Well, everybody, it's hard. I don't want to leave, but it is almost 4 o'clock on a Friday afternoon on a glorious weekend in Wisconsin. So we will close it, but please join me in thanking Michelle and all of the ABHI folks for sharing their treasure trove of wisdom. This has really been wonderful. And we've recorded this for now and to share with people who weren't able to be here, and also for posterity, because people are going to look back and go, how did they do that? So we're kind of, as Michelle said, it's a bridge from ABHI, which your grant is ending, to MHAP, which is starting, and it's really huge gratitude and thanks, and I'm really excited. A couple of announcements before we leave. There is another learning session on Friday, April 19th, which will be on mental health disparities in Wisconsin. Dr. Abra Vigna from the UW Population Health Institute will lift up the 2019 gaps analysis. And then we will have a panel of diverse respondents saying, okay, this is what it looks like now in 2024 from our lens. And so we really hope you can join us for that. Again, it's at 2:30 on a Friday. And then our next MHAP in-person meeting will be in Wausau at North Central Health on May 22nd. So mark your calendars. That'll be in person, and we'll do some of that kind of relationship building that we identified as being so important today. And with that, thank you, everybody. Have a wonderful weekend, and we'll see you when we see you. Take care. Bye-bye.